as I said, I had total knee replacement on 2 knees Thursday, November 6th. I think this is the 11th, and as you can see, I'm doing pretty well. I'm just going to explain this a little bit more when I sit down out here and let you know about having total knee replacements. As you can see, I've got pretty good range of motion, and I will explain that a little bit more when I sit down how my PT went today. So it's something you can look forward to in your old age. Yeah, well, we're here to talk about knee replacements and how that works out for some people, and I want to give you my intake on that. And I appreciate you following me here on BL Trails and Tales, and this is going to be one of those tales that, well, it's more of a medical issue, I guess, because I had both my knees were bad, and I think if you've watched some of the podcasts and whatnot, you've realized that my right knee, I had them x-rayed twice, once in Grand Junction, once up in Meeker, Colorado, and the right one, well, they're both bone on bone, and both had bone spurs and both had arthritis, and the right one was really bad, but the doctors want to know how the hell I walked on that left one, and that's when I ride in the stirrup and gets most of the pressure, right, especially when you're team rope or whatnot. But so anyway, I bit the bullet because the time of year and stuff. It's beautiful, gorgeous weather here in Colorado right now on the western slope to be riding, but I wanted to heal up by springtime, and I searched around a lot of doctors and whatnot, and found those people up in Meeker, Colorado, and they were suggested as being one of the best in the nation. And I thought, well, how can that be? I mean, that's kind of a cowboy town up there, and so I went up there to visit them, and I figured I'd be getting into a vet office or something like that. But no, they have a really nice operation up there. New facility, new hospital deal that's being expanded and whatnot. And I highly recommend them. The doctor I went to is relatively new there, but he's not new to these surgeries and this robotic procedure that they use. And after visiting with him, I found Dr. Myers to be a very intelligent, very likable, very knowledgeable person, and very caring, as was with their whole staff up there that took care of me. And anyway, they took x-rays up me up on the pre-op, and then a week later I went back up for the operation, I guess, on the 7th. That was Thursday. I got out of the hospital on Friday the 8th. This is Tuesday, I think, the 11th. And I just had my first PT, which is physical therapy. And the first, they give you a block. I had a spinal, and then I had block below the knees. And so in the hospital, you're really not very sore. You're not very mobile, but you're not very sore as far as that goes. And if you are, I mean, they can give you oxycodone or whatnot to help you through that. And I think I did request that once or something. But overall, it was a good experience. had family members come up, pick me up Friday, and drive my truck back down to the house, and I don't know, guy came back with 8, 9 meds, something like that, to take anti-inflammatories and whatnot, some painkillers, some stool softeners because of the antibiotics and stuff like that. You got a pretty good dose of meds, and anyway, that first day getting back wasn't too bad. My brother had a big wreck, and picked him up in Palisade and came back out here to Fruita, and shoot, he was more burgered up than I was. He got in a wreck with a mule that he was riding, breaking and whatnot, and just an accident there. But he was in an orchard, and shoot, he ended up getting up, busted up real bad. His head was he had like 9 stitches in his forehead. It was all laid open. His jaw, he had like 7 or 8 stitches in here that was bad. And they busted up the arch on his foot, which today was the first day he got up there to see a surgeon about it. And I guess if he's real careful and stays off of it, that it might heal up fine without having to have an operation. And so we pray for that. And but anyway, they brought me back down here and got me in the house and got me situated. I don't have anybody here, as far as that goes, so I was taking care of myself. And that first morning was a little difficult because the blockers were wearing off on your knees. And so if you had a loving person in your home to take care of you, it'd probably be nice, But I yelled and screamed and got up off of the toilet anyway, But that's, your knees are bent past 90 and they just weren't ready for that. But anyway, made that work. And then I'm pretty good at, I'm taking care of horses and dogs and myself, actually. And so I was doing my own physical therapy as much as I could in the house. And I think that went well, and my recovery's just been doing really, really well. And I was anxious to go to the physical therapy down here at Fruita. I was down there at 7:30. Got lucky. I was going to have to ride the 4-wheeler down there because nobody was going to come pick me up. So, but anyway, they got that lined up, and so that was a blessing. They got me picked up and brought me back home after my physical therapy. But I want to tell you how that went because I'm totally impressed with the operation and with my recovery so far because I am active. And I do as much as I can in the house, like I said. And I think that if you're going to have an operation like that, you need to be aware of your body and push it as much as you can without pushing it over the limit. And I'm usually over the limit, but so I had that in the back of my mind, so I was being very careful. But anyway, I went today, and because of the exercises I'd been doing and the icing and the regimen of stretching and walking, and I've been really, really doing some stretches. The physical therapist said the goal was in 2 weeks to have you bending your knee at like a 90, right? Well, and then, but you're supposed to keep it straight too, so it doesn't get stiff. And so I've been working at that real hard and strengthening my thighs as much as I could. And through the PT, she took the socks. I have compression socks on, so you don't have reduces the chance of blood clots, right? And so she took those down, looked at them. She thought the bruising looked really good and thought the swelling was excellent. I've been obviously walking, trying to make sure I don't get swollen or any more than what's there. And so she was impressed with that. And then she was impressed that I could get my legs out as straight as they were. Like the deflection, she thought, well, if you could get 2% more, that would be like normal. And so I was right there getting them extended and doing well with them like that. I'm not going to show you well, I don't know if I can show you or not. Anyway, I do pretty good. Let me put it up here. There, can you see that? Nope, you can't. Anyway, it's up on the table. It's straight out. I don't know why this stupid camera it's not working like it's supposed to. But anyway, if you're going to do that type of stuff, you need to do your own rehab and do as much of it as possible. They're doing good. Then she wanted to do the flexation, you know, to get your angle and your knee coming back towards you like you were squatting, right? And the goal there was to get your knee at a 90 within 2 weeks, and then at the end of physical therapy, they were hoping to get it at 120 or just a little bit more. 120 was normal, they thought. Well, she did mine, and my left knee was the one that was really, really bad, and I got it to an angle of 110, not 90, 110 out of 120 as being really good. And then the right knee was 112. So they were really impressed with that. They thought I did a really good job, and I was walking good. I don't have pain. I'm not taking the opioid painkiller. I do have a glass of wine or something with lunch and dinner, but I'm not having to have a painkiller, and so that's good. I'm looking forward to full recovery. Told them I wanted to be riding in 2 months. You know, that may be a little optimistic. It just depends on the strength. I go up in 6 weeks, I think. 2 weeks I go in town and they reevaluate, take the bandages off, and look at the stitches, and I guess I was told I don't have stitches on the front. They're internal or something like that. So I don't know exactly what they're going to take out. They're kind of underneath a bandage there, and I really can't see them. But anyway, I get that done in 2 weeks, and then 4 weeks, 2 weeks or 4 weeks later, go back up to Meeker to have them x-rayed, and then have the doctor evaluate it and see where you are. And but right now I'm very optimistic. I talked to him. He's real knowledgeable about alternative treatments, such as a red light. My big red light walked away in January, but I got a little one, little dome that goes over my knees. I used that yesterday. I used that today for 45 minutes. Red light helps stimulate your blood vessels and help reduce pain and swelling, and so I'm using it. Obviously, I'm using a lot of ice. After I get done walking and exercising, I try and ice it 5-6 times a day at least. That's helping to keep the swelling down. What else am I doing? Oh, I have that pimp machine that I've used on horses, and he said that, you know, research that. I gave him the information on it, and he said, yeah, you know, I'm totally open to that. He said, but why don't you wait, you know, a couple of weeks? And I think that I'll wait a week anyway until I do that, and then start real low. But that also is supposed to help stimulate your bone and bone growth and reduce swelling and stuff. And I know it worked great on the horses that I've used it on, and I think that it'll work good on my knees, and so I look forward to that too. So I'm doing everything I can possibly do on my own, but I just want to put a shout out to the doctors up there in Meeker, Colorado. The facility is excellent. The procedure that they use, I mean, I couldn't say anything more about it. My knees, for the most part, feel great. You know, I mean, I had total replacement, you know, Thursday. That was Friday, Saturday, Sunday, Monday, Tuesday. I had 5 days ago, I guess. And as you can see, I could walk up and down some stairs. I go in the house, I walk up and down stairs to exercise it, try and strengthen that thigh muscle. I move around as much as possible to make sure I don't get blood clots and keep blood flowing. So if you're going to do something like that, I highly recommend the facility in Meeker, Colorado, and also highly recommend that you have somebody with you, if at all possible, during your recovery, to make sure that you take your meds correctly and that they keep you mobile. You know, I can do that on my own, but a lot of people can't. So having some encouragement, and I've had family members come over and check on me, you know, and give me encouragement, and that helps a lot too. So you need the full support group, but I wouldn't be afraid of. I was afraid going in there, you know, getting 2 knees pulled out and 2 knees put back in. You know, that just sounds like not very natural as something that you want to be doing. But I think it's going to work out great. People I've talked to said they were so glad that they got it done, you know, after they've got healed up. So anyway, if you see this, and if you got friends or family that are looking at total knee replacement, send this to them, have them listen to it. I encourage them. I've had great results, and if you have any question or whatever, give me a comment, and I'll reply to them just as soon as I can. So anyway, yep, doing good.